Sue, what's the one thing that people need to know about social care?
Well, I think when people choose to use social care for whatever purpose that might be, I think it's a big decision and it's a big emotional decision for people. In my experience in working in the care home sector, I think people felt an element of guilt. And I think the one thing I would say to people is be honest about the person's health that they're placing in care and their requirements. Quite often, we would find that people didn't always tell us exactly what their needs might be, even though they knew them very well. And that led to all sorts of issues after they'd been admitted. So I think it's really important that families are honest with their potential care provider about the relative's health and requirements. And they also share any fears and concerns they've got about placing someone in care so that those can be addressed early on as well. I think sometimes things emerge later on and people don't always explain how they're feeling. I think it's really important. And because the reason I say all that is because I think ultimately care providers are actually trying to do their best for people. I think sometimes it's certainly historically, perhaps less so now, but the sector used to have quite a bad reputation, people going in to die, panorama horror stories. And I think it's important for families really to remember that actually care providers are trying to do their absolute best for people and things do happen, but to be understanding of that. At the end of the day, people are just trying to do their best and things go wrong and we need to address that. But those are the sort of key things I would say, really.
It's really really interesting that you've drawn on emotion, guilt, honesty, fear, understanding, really emotive terms as almost a bedrock of what social care is and how people interact with it. Your previous background at Barchester was very much in governance, which I think unfairly can be characterized as audits, checklists, and ticking stuff off. Explain to me how and why you're placing emotion right at the heart of care.
That's a great question, actually. And I think it's important to remember that we are looking after people and people are looking after people. And this is about putting residents or patients, whatever terminology people are using, at the center of the service provision. So it's really important we start with the person. And, we've got to recognize individuals moving into care, whether they've, got full capacity or they've got dementia, suddenly have to move house, move their home, their life, leave their friends as they see it into something very unknown. So I think we've got to recognise the individual in all this as a starting point, and the emotions and feelings and senses that they're having as they move into a strange place, somewhere they could be living for quite some time, not always through their own choice either, or certainly maybe through some persuasion that that's best for them. And so I think all of those emotions come into play. In terms of my previous role, I mean, yes, it was about governance. It was also about compliance and making sure that we were delivering great quality. And I think that you can't do that as a sort of tick box clipboard exercise. Governance is about putting people at the heart of what you're doing to make sure you do things well for those people. And so from my perspective, it was always about making sure we do that right for people, and emotion and all of that goes with somebody moving into care. A care provision is all about the emotion. If we just stick to the rules and stick to sort of the science and the black and white of it all, I think we completely miss the point. And we tick the box, as I used to say, we tick the box and miss the point. The point is to provide good quality care and support and treatment for people 24 hours a day, 365 days of the year.
Which is actually a really big ask. I'm particularly over a service as big as Barchester, but even if you break it down to the smallest 20-bed care home, delivering that consistency of great person-centered care, meeting their not only care needs, but their emotional needs, that's incredibly tough.
I think it is. It is a big ask, and I think it's not just the emotions of the resident or the patient and their families, but also the staff. I mean, I think people work in care because they want to do it. We all know it's well documented. It's not the best paid sector to work in, particularly at the front line. And I think people work in care, choose to work in care, certainly in the front line, because often they're already caring for people. So they're already emotionally invested. And I talk about, and I've talked in the past when I was at Barchester, being emotionally invested. And I think that's what I felt was so powerful about the organisation I work for. And I think it's true of a lot of providers, not just the people delivering direct care, but everybody supporting that is emotionally invested in what they do. And so I think it comes with having a clear vision for what you want to do and achieve, and making sure you deliver on that. And when it's not being delivered, to call that out really, and make sure that everyone's aligned to what the aim is, to give somebody good quality care, help them live the rest of their lives as best as they can, doing the things they want to do in the way they want to do them. And I think if you use those as your guiding principles, then it's important. You can achieve that. It's not easy. When I was there, we had 260 odd services, and they've opened more since I've left, and it gets bigger. And you know, but it's true whether it's a small provider or a big provider. Everybody should be trying to do their best every single day. And I think most people aren't doing that. I think the horror stories on the Panorama programs of the past, picked on one or two examples, poor examples, unfairly probably, that tarnish the whole sector. And actually, most people go to work to do a really great job, and things go wrong. And you've got people looking after people. Inevitably, things go wrong. People are high risk, have demands. Staff come into work every day. They may have walked out of the house with some emotions running high for something that's happened at home before they even walk through the door. And I think we've got to recognise all of that. You're not making widgets, if you like, in a factory. This is, it's just not any of that. And that's why I think it's quite challenging to recruit to. You've got to get people with the right approach. And I'm sure we'll get onto all of those sorts of things. But I think it's not easy, but it can be delivered at scale. And we delivered it at scale pretty well, I have to say. There were times we didn't always get it right, but we also then managed to address it quickly. And our ethos was, if it's not right, we'll put it right. And we always had a mantra of quality first. And I think you have those clear vision, you have clear governance arrangements that make sure you deliver on that vision, and then you use those arrangements to check that that's what is being delivered out there on the front line in all the services to every single person that you're looking after.
It's that quality first mantra is something that I think a lot of people would expect, obviously. I think a lot of people then see, well, actually, compliance and governance in many industries, and I am talking about the wider economy here. Quality and governance. Sorry, rephrase. Governance and compliance is a cost to be managed. It doesn't necessarily drive the business forward. And when you're operating at scale as Barchester did, you've got external shareholders and pressures and funding arrangements that a smaller provider doesn't necessarily have, and we're a family business. If our majority shareholder gets grumpy, I've got to say, Dad, calm down. It's we'll get there. He doesn't calm down, but you had a different environment. What was that like, balancing that pressure between managing the cost of governance but actually using it to drive quality, which fundamentally drove your business?
Yeah. I mean, I was really fortunate in that our chief executive, Pete Calverley, was very keen on making sure that we did things well and did it properly. And, over the time that I was there nearly 12 years, we really invested in the quality team that I managed. I mean, it went through periods. It was reasonable size when I joined. We went through a restructure, so we reduced it, but soon realised actually that wasn't right. And in fact, as I was leaving, it was growing again. We did invest in getting the right people to do those jobs, but equally, it was a joint effort. So it wasn't just about the quality team going in and saying, you got this right, you got that wrong, or whatever. We ensured that our regional directors were going into their services once a month. So whilst my team used to go in tops probably 2 or 3 times a year, depending on the risk-based assessment of each service, the regional directors would be doing quality audits every month. And so the two dovetailed, and then there would be other elements of auditing overlaid on top of that. So as a business, we recognized that we had to get those processes and systems right, and we would set our own standards. So it's one thing to audit against the regulations and the CQC and other regulatory requirements. We always intended to make sure that we assessed ourselves above those standards, so to Barchester standards. If we met the Barchester standards, which we felt were what the residents and the patients and the families wanted, then and our business wanted, then we would get it right for the regulators. So I think it's a false economy not to invest in it. In whatever size of organization you have, you need somebody who is checking those things. I was always, an adage somebody once said to me is, you need to check the checkers. And it's really important that, people do their own audits at home level. So we also start with that. The managers would be doing their own audits once a month. The regional directors would check on that. And then we would do corporate audits that would check on that. But we knew that if we got those governance arrangements right, it would drive the quality. And we proved that over the years. Since when I joined, we were at 40% good and outstanding ratings. By the time I left, it was nearly 90. Well, it was just over 90 when I left. And so in just under 12 years, we'd driven that quality by 50% in terms of outstanding, which was a phenomenal result. And we had to make some changes to the audit process and things, but it worked. But it was because also the vision and the mantra, if you like, the understanding people had was that we were there to deliver good quality, because if we didn't deliver good quality, the commercial success wouldn't materialize either, because you can make money only for so long. People are in beds only for so long. And as people pass away or move out, then obviously your results, the financial results start to dip. But if you get the quality wrong, then actually, you get embargoes, people don't place with you. And so it still impacts it. And so we were always had a very strong, clear view in Barchester that actually the quality drove the results as well. But it was important to get it right for people. That was our primary aim throughout.
There's an interesting question, which is sort of the provider in me sort of really wanting to ask this. Where we operate as a family group, we operate across different geographies. So actually the impact of a failed service, which we very rarely have, or an issue, tends not to cause other issues. With Barchester, it was the biggest, well, obviously still is the biggest single care home group in the country. If you have a localized issue at care home A, how did that percolate out within the rest of the group? Was it still a single, this care home has a problem, or Barchester has a problem?
I mean, it's interesting. When I first joined the company, the brand wasn't as well known as it is now. And I think that we deliberately took a view that we would be marketing locally and we would want the care home locally to be known. I think as times developed, times moved on, and we've all done a number of external activities, and particularly in my last couple of years, I did quite a lot of external speaking. The brand's become more well known. And so whilst you might want to contain it, it doesn't always happen, the bad news. But we would treat it in several ways, really. Firstly, obviously a local issue for that home. However, the important thing when you get, a poor result or something goes wrong in a service, you want to make sure that that's not going to happen elsewhere. So it was really important that we learned lessons. So we would do constant reviews. We'd reflect on what had happened. We'd try to understand why things perhaps hadn't gone as well as we'd hoped, and then learn from that and put new procedures and practices in place and train those in, issue policies, communicate through our monthly webinar for managers to make sure that everyone understood, what had happened without obviously breaching any confidentiality, but actually making sure that we could assure ourselves that things were right across our other services. And you're right, it's hard when you've got that number of services to keep a handle on it. When you've got a smaller business, it's easy to get your arms around it and know what's going on almost, with every person in every place. And it's harder, but that's why you have a structure of people. So we have, regional directors had up to 10 homes each, and then managing directors had their collection of homes, and they fed into the COO. So, but we had support teams for each of those divisions, and quite often each region, so that there were a number of people had their eyes on the services, and we would review and discuss those services at meetings with the regions, executive board meeting. So there was constant scrutiny and constantly looking at what was going on, because you cannot just let it go and hope it's okay. It doesn't work like that. I think quality is something you do, is a deliberate act. And I talked a lot about that before I left. You build quality into your systems. And I think it's important that going back to your original question, it's important that families know that actually, that we don't take a chance on this stuff. We can't, firstly, from a legal and regulatory point of view, but actually any good provider worth their salt is doing that naturally, regardless of what the regulators want. And we were always of that view that we would go over and above that. And I'm sure you do the same with your quality services too. And I think that, good providers do that. It's what they do and it's how they're structured. It's not to say it was like that always. When I first joined, we had no real governance arrangements in the way that we did when I left. And we spent quite a lot of time building that. I mean, we introduced a new governance framework in 2019, and then we adapted our audit processes to deliver on that. And then we introduced all sorts of other strategies over the years, and a care quality framework as well. So, we spent a lot of time over the last few years really driving that and embedding it and making sure people understood it from induction onwards, really, and make sure that we were delivering on that day in, day out as much as we could.
There's a hell of a lot you've just gone through there. Vision, standards, values, quality frameworks, policies, processes, lessons learned, and this constant improvement. Um, I think the one thing that I've always felt when you walk into a care home or walk into any care service, that first 30 seconds tells you everything you need to know. Is it safe, warm, homely? What's the vibe? Are people laughing? Um, I think that's something you learn as a provider or as someone who's been in the sector for a long time. Um, but let's take this back to the person who's just about to go into care or is looking for care homes and what have you. What should they be looking for? What's their first 30 seconds? What's their first 5 minutes? What if you were in their shoes, what would you be asking and what would you be looking to feel and what would you be expecting?
And a number of things, really. I think it's really important, actually, and you can tell I'm quite a sensory person, a visual person. I think it's important to use your senses, actually. So, what happens as soon as you arrive in the car park? I mean, we had endless conversations about, first impressions do count. They really do, and people do judge on those. I know I do. And if I go in and there's weeds in the car park, you start to think, well, how well, if they're not maintaining the external, what's the internal like? What is the care going to be like? So I think, what do you see as you turn up? How does it look? How is it presented? And, not everywhere has to be brand spanking new and brand new build. You can have a very homely, comfortable, clean environment that is an older building, but it's about looking after that. So I think it's really important that when families arrive, that they just take stock of what they see when they arrive, and that might stop them walking through the door. It might encourage them. So how well maintained is it? Secondly, I think the welcome for me when people arrive, how are they expected? Or if they've just turned up, how well are they greeted and looked after? It's always important to greet people with a friendly welcome and, an offer of a drink and, whatever other refreshments may be on offer. And I think it's then, you get a chance to sit down, perhaps while you're waiting for somebody to come and meet you. You can then use some of your other senses. So what do you smell? I know, there's also a bit of an adage that care homes smell of urine all the time, and they absolutely don't. And even if they do, they shouldn't do, because there are plenty of ways of addressing that. So that shouldn't happen these days, although I know it still does. Listen to what's going on. What are you hearing? What are people talking about? Is confidentiality being maintained by the person on the front desk? Can you hear activities going on? Is there a vibe and is there an energy about the place that feels comfortable? Or are you hearing things that you don't like the sound of? And I think it's then, in terms of the other senses, is about, when you do get greeted fully and somebody's come and take you round perhaps and show you around, do you have that sense that they're in touch with what's going on, literally? Do they know the people that they're talking about when you walk around? Do they greet the staff by name? Do they greet the residents by name? Do they know the families? Because what you want is to ensure that whoever's leading that service is knows their business, knows who's there, is actually also emotionally engaged. I don't think you can run a care home or a care provision without having that investment. I mean, I think if you need warmth, people need to feel assured when they go to a care home because they're going to place their loved one with you, and they don't want to go away worrying all the time about how they're going to be looked after. And I think all of those things, if you use those five senses, you can actually gain quite a bit, I think, in those first few minutes, really.
Mm.
And I guess you can taste, you get offered a drink, or, you can see what food is on offer. You get to taste all of that. So I do think you literally can use your five senses to assess what you think. And I think if you're not comfortable, something isn't ringing right for you, then maybe that's not the right place for your family member, or, whoever you're choosing to place there is maybe not the right place for them. Because if there's something niggling, then that's going to eat away at you. And I think you have to sometimes you have to trust your instincts a bit when you go into these places, because I think you can often be sold things. It's like when you go into anywhere, you're trying to buy a car or you're buying some other big item. And this is, we're talking about big purchase item here, aren't we, really? If you think about the cost, particularly people that are self-funding, but even if they're not, you still want to know that for whatever's being paid, that you're going to get the right care for your relative.
And I think that comment you just made around feeling comfortable ties all the way back to all those emotional decisions, and very much on the emphasis of you're at home. This is you are moving home, and your relative, and probably your parent is moving home, and that's such an emotional decision. Um, but then getting the quality is always it's not an emotive metric. It's percentage compliance on an audit. It's yeah, for us, it's all about, a lot of it is weight gain, and we look at Waterloo scores and some really, quite clinical metrics sometimes to build up a picture of quality. We don't track the number of smiles on faces when we walk in through the front door. We don't track. Well, it's a yes, no question. Does it smell? But we certainly don't track what does the food taste nice today? We don't go down that sensory route, and yet that's what makes a home. From how would you be how 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 was, from a governance and compliance perspective, how was that being tracked when you were doing it, and what would you expect providers to be doing in the future to track that?
I think it's really important to get feedback. I'm sure a number of providers have surveys. We used to do an annual survey, but we could do a pulse survey so we could check on people. It's really important that you, as a manager running a service, make yourself available to hear from residents, relatives, families, staff, sorry, and also visiting professionals or other visitors to the service, to make sure that, if they say something good or something that's not so good, that you take action on that. So we would always talk to people. If any of my team were going in to audit a service, they would talk to all of those groups of people, and those would be metrics we would track. We'd also look at the complaints and compliments that we'd received in writing, and we had a system to track all of that as well. And just some of the anecdotal stuff, you could be just sitting chatting to people, and it's just, oh, how's this, or how's that, and how's the food today? Or so there are ways of tracking it, and I think it's important to do that, because the regulators definitely do that, and you soon know if somebody's not happy with something. Um, we would do, and we could do Survey Monkey type, short, sharp type surveys as well. So we would encourage our managers to not just rely on the annual survey, but to do regular things. They should have relatives and residents meetings, staff meetings. Those are all ways of gathering feedback. I know some companies use, exit interview sort of systems. They can capture information instantly, but like you do in some of the hospitals and train stations and things, so you can do that. And there are companies out there helping people, because I think the important thing from the regulator's point of view is actually they're more interested in what people say about the service, and that being mostly the staff, and the families, and the residents and patients, to be honest, than they are about what, necessarily the paperwork says. But it's how you triangulate all of that, because equally you can have people that complain about something, we try and resolve the complaint, and they're still not happy. So you do need to work on that feedback and think about how you're going to address it, because it's all very well hearing the feedback. If you do nothing about it, it's a waste of time. So it's that iterative process all the time, I think, to try and improve on things.
And yet there is even more data, and pulse surveys, audits, frameworks, exit interviews, and we're adding in more electronic data, not only the electronic care plans, medication, falls. I've now seen something that will take your menu, split it down into the macronutrients, percentage eaten, and then go, right, here's how many grams of protein you've had over a day. Which I'm actually really excited about. But from a governance perspective, do you think it's feasible that care homes in the UK are actually going to be able to cope with this and this proliferation of data, given where CQC are going with their framework?
I think it's very challenging. I think, the hardest job in the care sector is the manager running the service, without a doubt, in my view. And I think that we've got to equip managers to have data and but also help them use that sensibly and intelligently without being overwhelmed. And I agree. I mean, we were a very data hungry organization. And I'm sure you're the same when, if it's your business, you want to know what's going on. Um, and of course, on the scale that we were working at, there was masses of it and masses of numbers. And it's trying to make sense of all that and using and not trying to collect it twice and making sure that we're using what we got smartly and also having one set of data. That was the challenge we had, that you'd have different buckets of data being collected, didn't always say the same thing. And we were definitely working on our systems when I left, because we'd only in the last sort of 2 years introduced electronic care planning. We had done some piloting on electronic medication, but not actually rolled that out, believe it or not. So we were behind the game a bit on that, and obviously all the other digital transformation that's coming. And so we were in a big transformation rollout period. So we had purchasing systems and CRM systems and all sorts coming in. So it is demanding for managers, and I think you've got to make sure that managers are quite tech savvy as well these days to be able to cope with all this, but also make the reporting easier so they can just, at a press of a button, pull the data out, understand how to use it, and understand what they can do to make their service better if they need to. And it's a big job. I mean, I had an analyst in my team churning through data, and I'm sure other organizations do. And then we had a financial analyst, and because it's not just the data, it's the quality data, it's the financials as well, and all the other things they have to do. It's a very demanding job, and I think we need to make it as easy as we can for managers to do all that, support them with it, help them see the opportunities as well as the threats in the data, and know how to address all of that, really.
Do you think I'm fascinated by, because Barchester is in is one of the larger groups. In my head, it was always in a different place to the vast majority of other providers, and you had a very clear structure, and you had regional support plus a strong governance team, obviously, and other bits and pieces. I think it allowed you to look at your business in a slightly different way. Whereas you've got the vast majority of care home providers who are traditionally one or two, I think it's actually now 3 or 4 properties that they are. Then we're now in a position where we're saying, well, actually, we're still very reliant on a registered manager doing an awful lot of the job. We don't have that huge support function. Do you think there's a model now where some of the larger providers are actually going to move away from this traditional registered manager, deputy structure, and actually hybridize it and do something perhaps different and innovative in how they actually operate a care home, recognizing you still need to have a registered manager because CQC, but actually, is there a different way of operating now?
I'm not sure not sure I've seen some of that. I mean, the only thing we did, I mean, where some of our biggest services, you might have maybe a clinical lead and a deputy as well. Or and we did try something where we had a manager and a sort of commercial manager, so that you had the manager sort of managing the service and the other manager taking on the data side. But that didn't work terribly well, because at the end of the day, you need somebody who's ultimately accountable. And that's what the registration of the manager does. But I think it's how you support them. So it could be that there's not another manager, but it's about, I mean, our administrators in our services were actually very skilled people. And I always thought that sort of a sort of tripartite of people working in the care home was the manager, the deputy, and the administrator, because the administrator would be running the payroll, issuing the contracts. And, if they were really good, they were doing quite a bit of analysis for the manager, collating data and things. And I think you need a team around you as a manager that can do a number of those things. It doesn't all have to be the manager. I think it's how you build the team to do that. Whether there's other models emerging, I don't know. Whilst the manager has to be registered, I think it's difficult to create an alternative, because ultimately they're accountable. If it all goes wrong, they're the ones that end up in court, etc., etc. Not to put too fine a point on it, but I think it's, but equally, we've got managers who've had burnout, we've had COVID, and all the sort of mental health and well-being elements that we've talked about over the last few years. And how do we attract good managers into the sector? Because, some people came into management as a carer, have worked their way through the organisations. I'm sure that happens across the sector, and have been promoted because they do things really well. But suddenly they've got electronic systems to manage, they've got a budget to manage, and some don't adapt to that very well. They find that quite difficult. And I think it's really important that they're given that support with their progression. So we don't just promote. It's easy to promote people from a deputy into a manager, think, great, we've got a great manager. And we spent a lot of time doing that. We didn't have a lot of success at first, and we realised we needed to really work with the deputies. If we're going to promote them, just because they're a great deputy didn't make them a great manager. And quite often you could promote people beyond what they felt they could do. And it's really important to have the right people in the right jobs at the right levels, doing the things they love, but doing them well. And there is a danger you can over promote people and then find that actually you've lost not only a deputy, but you've lost a manager when it doesn't work out. So I think it's fine making sure people are well equipped in their journey, in their career, to do the things they need to do. And I think probably the remit for managers has changed a lot, probably in the last 10 years, really, in the time that I've been there, in terms of not just there to, look after people, but they're there to fill the beds effectively from a commercial point of view if you're in a private sector business. And now you've got all this digital transformation overlaid on the top when, some of them may or may not have had a smartphone a few years ago. So it's ever evolving, this sector, really. And I think, other sectors may think, gosh, you're only just getting into digitalization, but, that's where we've been, isn't it? And now it's going at pace. And I think there's a lot of demands on managers. I think they're all things to everybody. They've got to answer to the business, answer to the families, answer to the relatives and residents, and answer to the regulators and everybody else that comes in. And I think there's a lot. We ask a lot of those managers, really. And so we need to make sure we look after them because they're a precious resource. They really are.
So really interesting. You brought up the NHS, and I am increasingly of the view that I think that having a national department for health and social care doesn't work. I think that you've got possibly a national hospital service. I think you've got GPs, pharmacies, and local community. And then you have social care, which you can either say is a wraparound service or foundational or however, and we seem to percolate throughout. My personal views. Where do you sit on the NHS and how that should interact with social care, and how do we move forward as to solve that question?
Yeah, it's a $64 million question, isn't it? I mean, I'm inclined to agree with you. And I think the aspirations of a national care service incorporating all of it is great. But then I think we've been talking about some of this stuff for years. And, we've got the KC Commission and all of that review going on. And that's going to take quite some time, although obviously there's some reporting to happen this year. But I think that it's a really big nut to crack. And I think that, we've tried ICBs and ICSs, and that's all not working very well. I think there's the biggest problem is the argument over money all the time. Who's paying for it? What's the handoff between services? That transfer between services doesn't always work that well. As simple as people haven't got the care records or the medication as they go in or as they come out of hospital. It is really difficult, and I think that it's going to take more than this to do it. And whether this will do it, I don't know. I mean, I just think that there's constantly been reviews. It's easy to have a review, but nothing then happens out of it. And something's got to prove to me that it's going to be different this time. And I think, we're in a politically turbulent times as well. On the day of council elections that have been watched more closely than I think I ever remember, given there's a whole day dedicated tomorrow on BBC about the outcome of these elections and their council elections. But there you go. And I think that, the lifetime of this review is entering difficult territory in terms of the lifespan of this government and whether or not they'll survive another election. And I think so the political element is an issue. The willingness to act on what Baroness Casey decides or recommends or finds, because I don't think she's going to find anything particularly new. I think she's just going to get it all captured in one place, and it'll be all the things we've been saying for however many years we've been saying them. And whether or not there's enough impetus to then put the money, the systems, processes, and integration together to make this happen. And I don't know. I mean, we know money's tight. Local authorities haven't got any money. There's changes and reduction and restructuring the NHS currently. There are lots of people who worked in these sectors for a very long time who've been through all of this all before and seen no change. And I don't know whether this is going to be different enough to make that happen. So I'm with you. I'm not sure one system is going to work, but I think there's got to be better appreciation of the value and importance that social care brings to the party. And I think that is constantly disregarded, constantly ignored, and regularly not recognised. And I think we've got some fantastic campaigners in this sector, very notable people, as you and I know, who bang on about this all the time, and been on TV even in the last few days. And I just, saying the same things I've been saying for years. And at some point, somebody has to listen, and it's whether or not there's a willingness to listen and make this happen. But we'll see. But I'm not sure one organisation makes it happen, because effectively we are health and social care. And even, commentators talk about the Secretary of State for the NHS. They don't talk about Secretary of State for NHS and social care. And I've corrected, the BBC on this and said you got to call it what it is. Wes Streeting is the Secretary of State for both parts of this sector, and it constantly gets ignored. And I think if we can't even get things like that right, what hope have we got of a bigger piece of work that brings all this together? So that's my view. And it is my personal view. But
Do you think that it was interesting you said we keep saying the same things, there is no change? I'm as a provider, the proposed unionization of social care is potentially concerning, because we've seen what impact that has had in the NHS, in trains in London. It does cause it can cause disruption if there are trade disputes, and unions result in trade disputes. On the other hand, I'm looking at it as a provider and going, well, actually, this might be the vociferous change that we need in order to progress the sector. Do you think that actually the outcome of maybe these local elections, but certainly the next general election, is that watershed moment? Because we could go to reform, we could end up centrist, we could go a different Labour government. Do you think we are at that tipping point? The Baroness Casey refers to a moment of reform and change for social care, but actually the political situation is such that we might be at that tipping point. Is that what you're referring to there?
We could be, but I guess the problem is that, Baroness Casey's been instructed under this government, you get a change of government, and it all gets thrown out, as we've seen in previous reviews. And that's the danger, isn't it? I mean, I know she's working really hard to make sure this is as cross-party as she can manage. But at the end of the day, if somebody else is calling the shots in 2 years' time, or 3 years' time, or however long it takes, for any change to happen, if that does happen, then they're working to a different tune. And I just think that the continuity goes, and we have to start again. And it could be a watershed moment. It really could. And Baroness Casey's got a great track record on a number of the reviews that she has led. But whether is there enough this time? I think the problem is that you get a change of people and a change of decision and a change of idea about what should happen, and then it all just goes by the wayside. And I think that there's a danger with that. And I think that does happen with reviews, not just in this sector, but in other sectors. There's been all sorts of reviews about all sorts of things and great recommendations about what needs to happen. But unless those things happen, then nothing moves on. And I just wonder if we'll end up in that same cycle, really.
So one thing I'm aware of, time, and one question I did want to leave enough time for us to pick over is around Barchester and the Welltower acquisition, which don't want to go into details, but suffice to say mostly that because the CMA, I think, is still looking at it, and so one should respect their point of view. My point is much more around structure and the future of care homes. I'm wondering about whether all the governance, all the compliance, all the regulation, plus all of the changes that we're starting to see from fire regs and other bits of health and safety requirements, plus also the potential changes that we might need to see around funding. So, the smaller care homes that have traditionally been local authority funded only are struggling, on a sustainability point of view. So you start to reach a point where you go, okay, well, people are going to start exiting the sector. Businesses are start going to be sold. You're going to start, and there is interest in buying care homes. Of course, there is, very strong SWOT analysis. So I can absolutely understand why entities like Welltower, a foreign real estate trust, even UK trusts, will look to acquire UK care homes as assets. Do you think that model of moving to an opco, an operations company just doing the care, but a property company owning the asset? And I'm going to ask you to take off your ex-Barchester hat here, given all that. Do you think that's appropriate and sustainable? Do you think that's a model that works for social care in the UK, or should we be right to be asking the CMA to actually look at this in more detail?
Well, obviously, personal opinions only, really. I think I'm not sure it's a model that can work across the whole sector. I would not want to see one or two of these big investment trusts buying everything out, because I think you need the competition, which is what the CMA is about. But you also need variety, choice, and those sorts of things for the buyer, if you like. So as in the relatives or the local authority. And I think that what you don't necessarily need is everybody doing everything the same way, because then you lose individuality, you might lose innovation. Yes, you've got resource to plow into things, but I mean, I'm not there now, so I don't know what the impact is on Barchester with that purchase, and what the long term will look like, because it could well be that things will change. I don't know, but obviously they have a number of other organisations they already owned, and they're going through change and things. So whether there'll be some consistency across the whole piece, I don't know. And they've bought some quite big providers. So, but I think the diversity and range and choice, because actually some fantastic things go on in small providers. They really do, because I think that small providers have the ability to be flexible and respond quickly, and not having to worry about a whole host of other services they're trying to manage. And so they're dynamic, creative, innovative, and often it's the smaller providers that got the digital transformation in quicker than the bigger providers, because actually, we didn't buy it originally as Barchester because no other big provider had bought electronic care planning at that point, and we wanted to see, how was it going to work in a big provider. Well, by the time we then did get into it after the pandemic was over, actually a lot of other big providers had bought into it, so it was easy to see, and we learned a lot from other providers. But I think that if one or two big providers or big investment trusts buy the whole lot, for example, which is probably not going to happen, but if that was to happen, you've almost got an NHS situation, haven't you, where you've got one provider running the whole thing, and I don't think that's necessarily healthy. And I think that I think there's room for everyone in this market. And actually, if you think about the market, despite the big acquisitions and the big providers, they count for such a small percentage of the whole market. Most of the market, as you know, is made up of smaller providers. And I think you get that local element. They're able to be part of the community, which is what we were always striving for with our local services. And sometimes I think, people buying those services don't always want to be part of something corporate. I mean, I've been a corporate girl all my life, so it doesn't worry me, really. I've worked for big corporates in this sector and in other sectors. But some people don't want to do that. And there's this whole buy local thing anyway, isn't there, in retail? So why not buy local in care as well? So I think there's a danger people feel that they get lost in the machinery of it all, that it's just a number and all of those things. I think it's really hard when you're a big company to make sure that you don't lose sight of the individual, particularly as I go back to what I said earlier. It's about focusing on who we're looking after as a starting point. You've always got to remember that. And the bigger you get, the harder that becomes, as we talked about. So I'm sure it will still happen. And I'm sure, Welltower and others have got plans to buy other services. I'm sure that will happen. We'll see that over the coming years. And it's a good sector to invest in. It's commercially sensible. There's a lot of risk with it, but they have to balance the risk with the commercial success. You get consistency, and they can, roll out things across a number of different organizations. You get benefits of volume and all of those things. But I think we've got to make sure that the individuals in all of this don't lose out. And I actually think there's room for everyone, really. I think it's actually quite nice to have a mix. And I think it's good. It's healthy. It's good for people who are being looked after, their families, but also for staff. It's very interesting when you talked about the Barchester Way, because some people coming to work for Barchester didn't always adapt very well to working for us, because although we are a big organisation, and we talked all about how you get consistency, we did have a certain way of doing things, and say we, but we when I was there, we did have a certain way of doing things, and some people adapted really well to that, and some people didn't. I think it is that corporate piece. They were used to being in a smaller provider, doing their own thing, being a bit more of an entrepreneur. Whereas actually, we don't need 260 entrepreneurs at Barchester. You need people all doing the same thing, so that you keep that consistency, following the standards. So it's quite hard. And so I think there'll be people in the sector that don't want to be part of that big corporate approach. So I think again, long answer to your question, but I think there's room for everyone. There should be room for everyone. I think it would be sad if it all does get swallowed up by 2 or 3 big investment trusts. I think it's important to have that diversity. And also, the client groups are different as well. You cannot lump social care in as one thing. And I think we've got to remember that in all the reforms that come through. All the discussions during the pandemic about where do people with learning disability and autism fit in all this, because everything was all about care homes. And we've got to remember, we operate a very diverse service. People's needs are different, and providers offer different things. And I think that you can't it's not one size fits all, in which case, you need to keep that variety and choice of service provision and people operating those services, in my view.
Absolutely. I think choice has to be at the cornerstone of where we go forward, both from a provider's perspective, but also employees and the service we're providing. That's been awesome. Sue, thank you so much for your time. What's next for you? It says on LinkedIn retired. I can't believe you're going to stop. Is there
I am.
plan B?
I've not done a lot. I did a bit of market research for somebody the other week, and this podcast, and I've not done anything else, if I'm honest. I really have at the moment retired. I say at the moment, but I am so busy, and I'm doing things I love doing that I never had the time to do. So getting to the gym every week for 3 times a week, and walking 20 miles a week, and taken up floristry course, and getting back into my garden. And we had a big holiday just as I left, and got more trips planned. So just living life, really. So I don't know. I'm not keen to particularly work. I don't need to. My husband's quite a bit older than me, so we're also conscious of lifetime and life expectancy, believe it or not, because he is older than me and wants to be able to do the things we want to do. And since this year, and I live in a small village, and this year we've had 5 of our big characters in this village have passed away. And I think those things start to ring home a bit, and you think, how long have we actually got? And so I just want to make sure I can enjoy life while I've still got the energy to do so. But so I've sort of kept my hand in a bit with this. So it was lovely that you asked me to get involved in this, and it's been a pleasure to do it. But I'm not particularly looking to do any work. I actually don't have time to read. I've joined a book club, and I'm struggling to read the books each month because I'm so busy. I can't keep myself out of the garden, and just living life, really, and not rushing around like I was, and not having to go away from home all the time and things. So I do miss, the sector and the people, but I don't miss having to go to work every day, if I'm honest. So it's been nice to switch off, really.
Sue, all I've got to say to that is congratulations. Then you are living the dream. Well done.
Thank you.
Sue, we'll call it there. Thank you so much for your time. Really appreciate it. And there was tons of things we said we talk about which we didn't. I'd love to get some more time with you later on and see if we can pick those up.
Well, you're welcome. Yeah, just reach out. Hopefully you've got enough of what you need. But that it's been great to do. I've really enjoyed doing it with you, Michael. Thank you.
Really appreciate it.
You're
Thanks, Sue.
welcome.